I'm gonna click got it. Okay, I don't want to hit any buttons because next thing I know, I'm like live. This meeting is being live streamed and I just click got it. Okay. Community Lecture Series. I'm Allison Lejean, a registered nurse and director of cardiac services, and it's my pleasure to welcome you here this evening. Tonight, our lecture is on electrophysiology. Dr. Abdullah will be joining us.
Hi, everyone.
Unfortunately, due to scheduling conflicts, he was not able to join us here in person for the lecture portion, but we're fortunate enough to have it recorded. So we will be playing the recorded lecture, and he will be joining us for the Q&A portion at the end. Before we begin, though, a couple of housekeeping items I wanted to go over. If you have any questions, please utilize the Q&A section, and we'll do our best to answer as many questions as possible. If you have a question that's a little more personal in nature, please feel free to email me. My email address will be available at the end of the lecture. So it's now my pleasure to introduce Dr. Edward Abdullah. Dr. Abdullah is an electrophysiologist at San Antonio Regional Hospital. He completed his medical school training at the University of California, Irvine College of Medicine, and the University of California, Davis School of Medicine. He completed his internship and residency at Cedars-Sinai Medical Center in Los Angeles and his electrophysiology fellowship training at Good Samaritan Hospital in Los Angeles. Please join me in welcoming Dr. Abdullah.
Hi, everyone. My name is Dr. Ed Abdullah. I'm an electrophysiologist, and for the uninitiated, an electrophysiologist is a heart doctor that specializes in abnormal heart rhythms and the evaluation and treatment of them. I've been present at San Antonio almost 30 years. We opened the electrical heart disease program at San Antonio back in the 90s, and it's evolved into a very sophisticated center for treatment of electrical heart disease. One of the most common electrical heart diseases that I and others in my field encounter is this heart rhythm called atrial fibrillation. People can talk to one another as an abnormal heart rhythm and a regular heart rhythm. My heart's not beating correctly, as reported by my doctor, or a combination of the above. But that's what I'd like to focus in our brief little meeting this evening. So what is atrial fibrillation? Because again, it's something that's extraordinarily common. You've seen it described in the news, but I'd like to sort of drill down and give you something that you can hang on to. So atrial fibrillation is really this erratic, irregular heart rhythm that either can present as a heart rhythm that's going at a sort of a normal speed, if you will, or a fast speed. And people can either feel nothing at all or feel incredibly less well with palpitations, feeling tired, dizziness, short of breath, and sometimes they can have some chest pain as well. As I mentioned before, it's the most common rapid heart rhythm disturbance in the adult population in America and in the world. The issue about atrial fibrillation is it can range from having no major consequences to something that can be very devastating to the patient and loved ones. So here's a sort of a pretty picture description of atrial fibrillation. And so in order to understand the abnormal heart rhythm, you kind of have to understand the normal heart rhythm. So on the left here is a heart with the electrical system operating like it's supposed to. There is this area of the heart where the electrical heart rhythm is created called the sinus node, and that electrical wave spreads from the right atrium to the left atrium, and then it's got to get down into the ventricles, but it only is able to do so by a very special electrical cable that we're all born with. It's called the A for atria, V for ventricle, or AV node. So it is the only way for electrical impulses to go from the upper to the lower chamber of the heart. So in summary, upper firing in the upper chambers contract, the impulse goes to the AV node to the lower chamber to contract. So now you have a situation of upper chamber, lower chamber, upper, lower, lub-dub, and that's the normal heart rhythm that we're all knowing and accustomed to. And the electrical tracing of it is everything is incredibly regular. So this little wave, this little wave, this little wave, this wave, all these waves are coming on time, and they all measured equal and equal distances between each other. I'm not going to go into the what each wave stands for because I think it's sort of beyond the scope of our discussion. So this is normal. So now let's turn our attention to the abnormal. And this is atrial fibrillation. What that is just a bunch of areas of both atria firing fast and furiously. So this area, they're all firing away, and they're not really respecting each other's firing. So they fire so fast and furiously that the upper chamber can beat upwards of 500 to 600 beats per minute. Now, the good news is those 500 to 600 beats per minute can't get through the AV node, because it will only allow up towards of about maybe 150 to 180 beats per minute. And the reason that is because if the lower chamber were to beat as fast as the upper chamber at 400 to 500 beats per minute, because the AV node conducted them all of a sudden you've got this lower chamber beating at 500 beats per minute. And if you think about it, if it's beating so fast, there isn't any time for blood to get into the heart to be pumped in the right direction, and people pass away. So it's actually pretty fortunate that AV node doesn't allow the heart rhythm to go as fast and furious in the lower chamber as it does in the upper chamber. And the electrical tracing represents this chaotic state. So everything is irregular, nothing is equally spaced. And that's really the electrical characteristics that you'll see on your smartphone app, a cardiac of atrial fibrillation. Okay, so that's the difference. And I think it's pretty straightforward and appreciative. This is very different from this ordered type of electrical heart activity. Okay,